Chris Ogden, consultant robotic surgeon at the Royal Marsden in Chelsea.
It's some machine, isn't it? In fact, it looks like a couple of machines. We have a large robotic, I'm going to describe it as octopus, at one end of the room. You sit at the other and operate this. Just explain what happens.
The octopus, as you describe it, is a four-armed instrument on a cart, which is trolleyed into the patient's side, who's anaesthetised on the table, and this engages microscopic instruments, which are then placed inside the patient. Now, the instruments themselves are then driven via a cart system, which I sit in, to manipulate and transfer my arm and hand movements to the instruments, adjust the camera and use cautery to seal blood vessels using my foot. And open and close, you'll open and close the instrument.
This is like a very sophisticated games arcade, isn't it? You're looking down with all your feet going and arms.
That's the closest image, really, yes. And it's very like one of those arcade games where you feel like you're inside the game and transferring surgery into a virtual environment.
And what are the benefits for the patients?
The main benefit is they get over the operation so much quicker. So prior to the arrival of this particular robot here at the Marsden, the operation that I'm going to perform today, which is a radical robotic prostatectomy, most patients went home after a week. Now they go home the next day.
It must be expensive to run. That must be its downside.
Exactly. And the stats don't really add up unless you're doing sufficient numbers. There's no good investing in £1.5 million machine that costs $100,000 a year to maintain if you're doing one case a month.
That was the consultant robotic surgeon Chris Ogden from the Royal Marsden Hospital talking to Leslie Ashmore and proving that clever bits of kit, as she called them, as Michelle called them, I think, need clever bits of doctor attached to them as well.